Good afternoon, everyone joining us in person and remotely online. This is the Charles Warren Fairbanks Center for Medical Ethics Clinical Ethics Fellowship Lunch and Learn. We are so pleased that you're joining us. My name is Brian Leland. I am the Fellowship Director here at FCME and a Pediatric Intensivist at Riley Hospital for Children. I am joined by Rob Naxbladum, who will introduce herself momentarily. We are going to go through the nuts and bolts of what the Clinical Ethics Fellowship here at FCME looks like, what its curriculum entails, and then walk you through what the application process would look like, and be happy to answer any questions upon its completion here.
All right, so today we're going to spend about 15 minutes or 20 minutes talking about the fellowship so you understand what it is, and then we will allow some time for questions. And so we hope that by the time we are done presenting that you will have learned the history and mission of FCME, that you will learn about the fellowship experience and the application process, and that you can then go back and help others understand how the fellowship will benefit you and then therefore benefit them, whether you're in a department, a hospital, or wherever you're at. So part of our commitment, we are an endowed center, and so the privilege of being an endowed center is that the fellowship does not cost you anything, and our honor then is to be able to tell the story of Charles Warren Fairbanks. And so Charles Fairbanks was a philanthropist, lived here in Indianapolis. He was a senator, then became vice president to Theodore Roosevelt. He was on the very first board of trustees for Methodist Hospital. And so it was about 25 years ago or so, 19 years ago, that his family came to Methodist Hospital at the time and said, you know, there is no memorial for Charles Warren Fairbanks in Indianapolis, and we want to do a living memorial for him. So they invited groups within the hospital to put together a presentation about how what they would do with this endowment. And so Steve Ivey, who at the time was director of vice president for chaplaincy and services, and he put together a proposal for a hospital-based clinical ethics center. His proposal was selected, and so therefore FCME, the Fairbanks Center for Medical Ethics, was founded in 2001. Paul House became our very first director in 2004, and he is still our continued director. And so as we think about our fellowship, the fellowship is one of the components that the Fairbanks Center for Medical Ethics does. And as we think about the fellowship, our mission is to really embed clinical emphasis throughout the healthcare system, throughout Indianapolis, and throughout the state. We have had people, as our fellowship continues to grow and influence-wise, we've had people from various disciplines and places around Indiana. And so in 2005 was the very first class, and then last year we graduated our 100th fellow. So what is the fellowship? The fellowship is 9 months long, and it is part-time. We meet 1 day a week, and so Brian is going to delve into these three components a lot deeper in just a minute, but I wanted to quickly just talk about them. That you will gain some foundations of ethical principles. You're going to delve into clinical ethics consultation, and then you will be able to have a scholarly project that's going to be pertinent to you, and then for you to then be able to go back and enhance wherever your practice is. Like I said, there's no tuition for you. And so what time are you looking at? What time commitment does this take? So it is 1 day a week. Wednesdays, you are here with us. We start anywhere from 7:30 in the morning to 9 in the morning. We're always done by 4. This year we will be starting on August 26th, and we're going to end on May 19th next year. We ask that you make sure that you have time set aside. You're going to have lots of scholarly reading. You're going to have a chance to be on call, to be the first call for ethics consultations, approximately 4 to 5 weeks, depending upon how many fellows we have and how we have to divide that up. And then you're going to need to set time aside for your scholarly project. So there is time that, not just the time that you will be with us here on Wednesdays, but time outside of that as well that you'll need to prepare for the Wednesdays. So throughout this presentation, we're going to share with you some impact statements that the past fellows have made, so that you can hear in their own words how they believe this fellowship impacted them. So Kristen Emile, when she did our fellowship, she was a pulmonology fellow at Riley Hospital. And she said, having a way to ethically analyze situations provided a great outlet for me. Before the fellowship, I used to feel a lot of frustration, burnout, cynicism about certain situations. But now having a way to critically analyze the situation, I feel much less of the emotions. I also feel that I'm a better, more calmer communicator with patients and their families. So Brian, why don't you go ahead and delve into the three components?
Thank you so much, Robin. So as the fellowship director, my job is to mold and evolve the curriculum in order to optimize the educational process for our fellows. I break our curriculum into three components: education, service, and scholarship. And we'll go through each of those individually here, starting with education. So our education process is primarily centered around didactic or interactive seminars. And we progressed from communicating and educating about the foundational principles of clinical ethics, then into seminars talking about practical application of those principles in really challenging areas of medicine, whether that be immigration or undocumented persons or uninsured persons or difficult decision-making surrounding end of life. Every seminar will be led by a content expert, and that's either one of the FCME faculty here or an affiliate faculty either in the School of Medicine or School of Humanities at IUPUI, sometimes even outside in the community, individuals from the Jehovah's Witness faith, for example. The average seminar has somewhere between 3 and 4 articles that fellows are expected to read in order to meaningfully participate. And since these are didactic sessions, it's of the utmost importance that fellows do the reading so that they can meaningfully participate and actually extract the important information from those seminars. We think and would estimate on average this is 2 to 4 hours of reading each week, depending on which session we're referring to. The second educational component is centered around what is functionally a grand round that FCME offers for 9 of the 12 months each year, where we will have a highly recognized expert come and present to a large group, alternating here between Methodist Hospital and Riley Hospital for Children, to share about a very important clinical ethics related topic. Next slide, please. Okay, so the second component of the fellowship is service, and this is primarily ethics consultation. And this is broken into 2 components as well. So fellows on the 2nd and 4th Wednesdays of every month will join the ethics consultation subcommittee group in their bi-weekly meetings where either active or recently completed ethics consultation cases will be discussed in a large multidisciplinary group. And this is a great opportunity for fellows to see what it looks like to embrace the value of different perspectives from different areas of expertise and watch as we navigate together to arrive at a set of recommendations, for example, if the case is ongoing, or challenge one another about the framework that was used to arrive at a previously established set of recommendations. In addition to that, each of our fellows will have approximately a 1-month opportunity to be the first responder or on-call for ethics consultation for the Academic Health Center. And this means they will carry not a pager anymore, but a phone, be the first responder to ethics consult requests, field information, participate in or facilitate medical team meetings or care conferences with families, in order to positively impact patient care or empower providers to ensure that patients' best interests are kept in mind as their care is provided. This can sometimes be a little intimidating when fellows hear about this. Worry not, every single consult will be fully supervised and facilitated with a supervising faculty. And then lastly, we have established a curriculum to help our fellows learn the unique and challenging skill of communicating via an ethics consultation note. And by the end of the fellowship, they will have a level of competence in that others do not. Next slide, please. The last component of the fellowship activity is the scholarly project, and Robin mentioned this previously, but the scholarly project is, I think, the fellows' favorite component of the fellowship, and that's because we ask fellows to come into the fellowship with communicated or identified areas of interest, and then we take that opportunity to help mold that area of interest into a feasible project that can be completed during the 9-month fellowship experience. And we take great pride in the fact that we don't dictate what that project looks like, but rather nurture it to meet the needs of the fellow. And so as such, it can be hugely variable, whether that's a more dedicated research project or development of policy that a respective hospital might adopt, or establishing a curriculum for education in a respective area of the hospital or greater community here in Indiana. Every fellow will be assigned a mentor, either here in FCME or in collaboration with an expert in the School of Medicine or that's employed by IU Health in order to help them reach their goals for their scholarly project. This does take time to do well, and so while we have dedicated time throughout the year for fellows to spend, for instance, occasional afternoons working on their scholarly project, this will for sure require that substantial time is spent outside of the fellowship activities working on this. Next slide, please. So illustrating some of the examples for the variability and quality of these projects, I'll highlight a couple here. So Sean Gerber, who is a chapel manager down in Bloomington, joined us, and he did an education in the form of a grand round talking about how you clarify spirituality and values for patients and their families in an ethics consult that's focused on end-of-life decisions. Another example would be Kristen Emile, who was one of our pulmonary fellows at Riley, and she did a really exceptional project reviewing literature and arguing for a shared decision-making model surrounding how to approach decisions related to initiation of chronic mechanical ventilation tracheostomy in patients. Next slide, please. So the scholarly project can be overwhelming at first glance and when it's first introduced, but we have a very organized and regimented process that we walk our fellows through in order to ensure that they can be successful. Everything from an opportunity for them to just communicate in an open forum. This is what I'm interested in, but I don't really know how to turn this into a project, to then helping them begin to extract data and literature from databanks and websites, to completing an annotated bibliography, to comprising a literature review. And throughout the fellowship, fellows have an opportunity to participate in what we call WIPs, or work-in-progress sessions, where in a low-stakes setting, fellows say, this is where I am with my project. These are the barriers that I'm seeing. Help me think about this component or this challenge that I'm experiencing. And then every fellow before the graduation day will do a final presentation sharing the information that they've gathered. Not all fellows will choose to publish, but many do, and we are equipped to support and facilitate that as well. Of approximately 100 fellows that graduated, we have 32 scholarly articles published by them in scholarly journals as of 2019. Next slide, please. In order to help facilitate their interest and acknowledging the importance of disseminating this information, our center offers our fellows an opportunity to apply for a scholarship where they can then go out to a conference that is pertinent to the area of interest that they have and present on a national stage the work that they've been doing in order to disseminate that information as well. Next slide, please. So Melissa Young was a fellow 2 years ago that I had the pleasure of mentoring, and she was a nurse practitioner in the urology clinic at Riley Hospital for Children, and she did a project arguing the need for pediatric urology providers to do child sexual abuse screening, given the very niche population that they manage. And she shared about her experience. I feel much more knowledgeable and comfortable in discussing ethical concerns with my team and my patients and families. I also feel more comfortable knowing that I don't need to have all the answers and that I'm familiar with the resources that can help with ethical concerns. I'm going to hand things off to Robin now that everyone wants to apply, and she's going to tell you exactly how you can do that.
That's right. So I know that you're excited and you want to know, can I apply? And we want to say yes. We want you to apply. We want all disciplines to apply. We select 7 to 9 fellows every year, and we intentionally make it interdisciplinary because we know that everyone brings such a great perspective with them. So as you think about applying, here's what you want to make sure you have or get ready. We will need either your CV or your resume. It doesn't matter to us what you submit. You will find when you start the application, you will see what the 4 essays are, but we have you respond to 4 essays, not huge, not thousands of pages or even thousands of words. I think 250 to 400 words is kind of what we ask. We have a letter of recommendation that is needed, someone who should be able to comment on your skills and merit for the fellowship, and a letter of support from your supervisor. Now, the reason those two have little asterisks beside them is because you are able to have those individuals that you invite to do that at another time. So there are various times throughout the application that you will find a link. And so you can copy and paste that link and give that to whomever. The reason I ask you for a letter of support from your supervisor is that this is really a guarantee for your time to be protected. It benefits us and it benefits you. First of all, the way it benefits you is that if your manager has said, yes, you can have every Wednesday off from August to May. And then let's just say in October, they all of a sudden come back to you and they're like, yeah, well, we need you to work. This letter is your way to say, I'm sorry, I can't work, and you told me that I wouldn't be assigned these spots. And it also helps us to guarantee that you will be there and continue in the educational investment. So this application is online only. You cannot fax it, you cannot snail mail it. You do need to go online. You go to our website, and so we're going to walk through that, what that looks like in just a second, but fairbankscenter.org. We then review all the applications and we decide who we would like to bring in for an interview. And know that it is competitive. Like I said, we are able to invite 7 to 9 fellows every year, and so applying does not guarantee an acceptance. So when you go to Fairbanks Center, you can go there today. We opened the applications as of yesterday. You are going to look at this great picture of our past fellows, and this is where we have our end of the year banquet. So in a couple of years, maybe you could have your picture up. And you will just click on read more, and then you'll go to apply. And then after you hit apply, I'm not going to be able to show you that now, but then you will see our application will pull right up. It is possible for you to start the application and then stop it. You could always come back to it. You just would need to write down the number that is given to you when you say you want to quit. You will be given an access code. You write that down, and then you can use that when you come back. So the applications are due by Friday, April 3rd by 5 p.m. If you try to submit it later, the applications won't be accepted. We will let you know by April 10th if you are receiving an interview or not. On April 27th and May 4th, you only have to come to one of those time slots. But those are the 2 days that we are going to be holding interviews. And then you will know by June 1st whether you are going to be a part of the next Ethics Fellowship group. We also have, if you are wondering about how to tell your manager or ask your manager for time off and how to tell them about the fellowship, for those of you that are listening online, you can go to our website, and when you are in the application area, you're going to see something that says For My Manager. You can click on that. It is a PDF that we have created of something that you can just hand your manager. Those that are here in person are receiving that piece of paper in hand. But that way, we have created that to help you as you begin your conversation with your manager about the fact that you would like this investment, that they are really investing in you. The reason that they're going to invest in you is so that you can then become a resource for your department, your hospital, your area, wherever it is that you're going to go back to. That you'll be able to provide a framework for ethical decision making. You're going to be able to support those who have moral distress. And you're just going to be able to then not just benefit you, but your colleagues. So you're going to be able to impact the ethical practice of those that you work with. And then you have the opportunity to stay involved with FCME and your ethics community, wherever your ethics community might be. So we encourage our fellows, especially that are outside of the academic health center, but within the system, to then become active parts of their ethics committees at their individual hospitals. And many of our hospitals, or all of our hospitals, where we have past ethics fellows, they are actively involved with their ethics committee. So just to close up, Sherry Bate is one of our people who continues to come back, and we are so grateful for her. Sherry is a respiratory therapist. She's been a respiratory therapist for 30 years, and she never received formal training in ethics. The fellowship provides the background that I was missing. My project confirms gaps within our profession, and I continue to work on different educational efforts to improve things. I continue attending the monthly fellowship ethics lecture series, and I'm encouraging fellow colleagues to attend as well. I believe the continued involvement helps me grow in understanding of medical ethics. So, lots of great impacts that the fellowship has on people. So now I want to turn it over to you to ask questions. If you are live and not driving, but don't want to, we know we have someone who's live that is driving. If you would like to text the questions, you're welcome to text questions. I have my phone with me. Not driving. That's the not driving part, yes. If you are driving and you want to buzz in with a question, please unmute yourself so that we can hear you, because we automatically mute you. If you come up with questions later, either down the road today, in the next couple of weeks, that is my email. And for those of you that are watching the recording, please don't text me, but feel free to email me. So what questions might you have? We have got about 10 minutes. I know that was very fast and very dirty. Go for it.
Where does the fellowship meet every Wednesday?
You're in the room that it meets. So it meets here in the FCME area in Noyes Pavilion, the Stephen S. Ivy Conference Room, which is where the vast majority of the didactic and educational sessions will be. There are occasions when a few of the sessions will be at the library so that you can become equipped to use some of those databases that I was referencing for literature review. And then occasionally we'll have some sessions at Riley Hospital for Children when we are doing our grand rounds at that location.
You're in the room where it happens.
Correct.
Thank you for guessing
this is where the magic happens.
It's a Hamilton reference. Sorry, Brian.
Yeah.
Yeah.
What non-Hamilton focused questions can I answer?
So before we had questions about the interview. Do you want to address the interview a little bit, Brian?
So there had previously been a question about whether or not interviews can occur remotely, and the short answer is no, that we have a very organized process for our interviews, which requires that you're physically present. If you have a truly unique and extenuating circumstance, we would be willing to entertain a conversation about that and evaluate whether it would be appropriate to interview you remotely if absolutely necessary.
And the process of interviewing?
Yeah, so our interview process is a little bit unique, but we really value it, and that is that we will have applicants, usually in groups of 3, be exposed to or introduced to an ethics case and then ask them to discuss it, acknowledging that you are not an ethics expert, but rather taking that opportunity to see what the communication skills look like for our applicants and their ability to think through in a careful, thoughtful, respectful fashion really difficult topics, which is exclusively what an ethics consult is. And at the end of the day, fellows, when they graduate, acknowledge that one of the most valuable components of the fellowship is their exposure to communication techniques and expertise. And so this is a great opportunity for us to see where each fellow or each applicant is as they're applying, so that we can make sure we facilitate that process in a meaningful way for them. And then that will last about 20 minutes. And then thereafter, each applicant will meet with 2 of the FCME faculty in a 2-on-1 interview that will last about 30 minutes. So the whole process, we say generically speaking, expect about 90 minutes from when you step foot in the center to when you will be invited to wait to hear from us. Yes.
Who are some of the mentors, or I guess what's their basic background?
Great. So the majority of the mentorship is provided by the FCME core faculty, which includes myself as a pediatric intensivist and clinical ethicist with a focused area of interest in pediatric ethics, communication, and family-centered care. Dr. Helps, who is the director here at FCME, who is a, pediatric gastroenterologist. I'm sorry, I assume everyone's incorrect, got carried away. He is an adult gastroenterologic oncologist and has done a lot of work with prognosticating, communicating about decisions surrounding end-of-life utility. Dr. Lucia Boschel, who is also affiliated with the School of Nursing in her areas of expertise, she is acknowledged as a national expert in moral distress. It's wonderful to have her from a nursing perspective, and she's has her PhD as well.
She's a nurse ethicist.
That's correct. And then here, joining us within the last 2 years is Dr. Amy Martin and Professor Jane Hartsock. Dr. Martin is the Executive Director of System Ethics for IU Health and was previously up in Chicago as the lead / only ethicist for a large healthcare system doing all of their ethics consultations, so her expertise there is exceptional. And then Professor Hartsock is his co-affiliate faculty with the I don't know if it's School of Humanities, not Department of Humanities, with IUPUI, and one of her niches is ethics surrounding organ transplantation. And she is, I would say, our scholar in many respects and leads some of the very fundamental conversations about foundational principles, looking at things like Kantian ethics and some of the really, I would say, hard and challenging basics of how ethics began and perspectives thereof. Did I miss anyone? And then Robin Axel-Adams, who is here, so I didn't feel like I missed her. And she is our program manager and a chaplain, and she facilitates the, interacts with the chaplains as well, and is one of our primary consultants. And we are excited. And quite frankly, I would be remiss if I didn't say that I consider Robin to be the Associate Fellowship Director, and she is integral to facilitating the rigorous curriculum that we have to put in place in order to help our fellows get a good experience.
I would also say potentially my areas of expertise are more around empathy, communication, values assessment, some of the softer side. Is that important? That's a great question. There's a wealth of knowledge. Yeah, keep going for it. You don't have to raise your hand, please.
Where can I find past fellows projects to look at?
So
we have them listed on the website. We do not have a link to them, but the publications, you'd be able to, if you go to the website and look at those that are on the website, I think most of them are published.
You have to look. Well, I can also, I mean, if you want, I can make sure I note. I keep a list of all of the publications. Now, the publications, and I don't mean to be diminutive about this, the publications are truly just publications. There's also been a lot that we've done that's not been publications. I never published my work, much to the chagrin of my mentors. But mine was teaching medical residents how to talk to their patients about spiritual issues. So I would be very happy to provide you with our list of publications and know that so much more has been done other than just publications.
agree, wholeheartedly.
So I think besides the list we have there, that list is not the same list we have on the website.
No.
So go to the website and look at other ones, but if you'd like to see what has been published, I can provide you that list.
All right, wonderful. We appreciate everyone for being here and being here remotely, and look forward to seeing applications from each of you.